The session this morning is to just look at some popular products for care home environments. So we've got a selection that we're going to share with you. We'll look at a few slings, some accessories, and introduce our chair. So hopefully it'll take about 45 minutes. That's good for you guys. But to start with, I've got my colleague Judith here, who looks after care home organisations as well. So she's often on the phone to you guys. But we thought we'd show you the first product, which is a little jacket. It's a lightweight mesh jacket, but it's got some handles positioned around it. And we've known that this has been really useful for people with dementia or slightly unstable gait, because it's a lightweight jacket with a side expandable zips here for outer clothing, so you can tighten that if needed. But the handles are positioned just to help guide somebody. So if someone's a little bit unsteady, rather than grabbing their clothing or their arm, then a little grip on the jacket there is quite useful. So I thought we'd share that with you because we know it's been popular. There's handles on the side there, or someone on a frame just to steady them. So lots of different uses and benefits, but it's called the Walk Assist. All the information's on the website, and we'll share the details as we go. But that's something just that I thought I'd share to start with. Hopefully, if there's any questions, please just, as I say, just drop them in the chat, and then I'll answer them as best I can. Thanks, Jude. We'll take that now. So looking at slings then, we know there's a lot of variety of slings, and it's where do you start? So we just thought we'd show and share some very straightforward shapes with you. The first one is a really popular style, which is a fast fit, universal shape, very standard shape, very common. It's very well known within the industry because of the shape. Universal shape sling. Every company will have this style. And I thought, well, I'll just talk about some of the features just to remind you. Silvalea now have fully woven labels, which are really clear. They're woven, all the information's on there. It's very important that the label is legible. So always encourage your staff, your carers, to double check that the label is legible. Otherwise, it will contravene the NOLA regulations. But on that label, it will give you important information on sizing, safe working load, or the laundering information, because some fabrics may vary to a standard. So it's very, very important. But the woven ones will last longer than the printed. So it's good, better value. Sizing guide there. Yellow, bright colour handle to denote yellow. Most companies will have the same colour coding. Small is red, yellow is medium, green is large. When you go higher or lower, they may vary, but general common colour coding throughout the industry there. Unique serial number and barcoding on the product for traceability. So there's lots of helpful information on there. The service label is a little grid on the label, and that's in line with the checks. So with your hoist servicing, then whoever's doing the hoist will check the slings, or should check the slings, just a common sense check to ensure the product is fit for purpose, and then they can mark it out on there. But it's really important to do a visual check each time the product's used, just for any signs of deterioration, thread snapping, any breakdown in the stitching, binding, popping, fading, discoloration, anything like that could have a detrimental effect. So it's really sensible to do a quick visual check before each use. Safe working load for standard products is 220, which is 35 stone. So most of our standard products will have that, and that is from the extra small to the extra large. So it still have that. because it's all been checked and calibrated. Every component has been carefully sourced to take in excess of that weight. Washing is important. Always follow the guidelines on the label or the instructions of the of use care pages. We do recommend a mild non-biological powder so that there's no irritant or fading. Some of the detergents now have bleaching agents in, a whitening agent, and that does discolour, and then it could be having a detrimental effect on the product. So if you see any fading to the tapes binding, it could be that, or high drying temperatures. If it's dried too high, then wadding can shrink, and again, some components can become brittle. So it's really important just to double check. So having said that, have we got any questions? We're all okay and we're quiet. Just quickly, I'm not going to hoist everything because of time, but this is, as I said, a general shape sling. Let's get Judith to, and I'm sure you all know this shape, it's very well known. It comes around through the legs there. The important thing is to always get the slings as low as possible so that the leg paddles come around and can be positioned towards the back of the knee. Always try and get that to start with. Once you hoist up, it will naturally readjust. But if you start with it slightly high or the leg paddle isn't low enough, it's just going to ride up and bite into the groin. So it's not going to be comfortable. But this one just comes through the legs. You cross them if you so wish to keep the legs together and then hook up. So very straightforward. It's a general purpose shape. I would say use it for general situations because it's just going to pull up and give a general pickup. If you have someone that's not so standard or compliant, then it may not be suitable. So if you've got someone that's quite agitated or extends and wriggles, it's just going to shoot up into the groin. So it's not so good for that type of situation. Also, often you may have someone with painful joints. And as this goes up to the hoist, then as the legs pull through, they can slightly externally rotate the hip. So in that situation, it would then impact on pain in the hip area. So don't use that style. So only think of that style for general scenarios. If you have asymmetrical body shapes, curvatures, then again, it's not so adjustable. We look at something else. Hopefully that makes sense. Think of it as a standard general sling for standard general scenarios, and then you'll be all right. We can, however, add head supports if you need a head support, chest strap, everything like that's listed on the website for you to have a look at. But if we have something a bit more unusual, then we'll show you the leave-in. So this is a leave-in sling. It's a deluxe leg. It's a very popular option for care home use. In many ways, it's one of our most popular styles, and it will give a different pickup and a different support, which I'll show you with Judith. Again, it's a divided leg sling, so if you get the sling as low as possible, and the leg paddles, individual leg paddles, wrap around the femur. It's certainly, you can apply it on the bed, but make sure you've got it low enough and the leg paddles come around the thighs fully. The legs connect together with this red modesty, and then you take the outside tape and thread it through. Little bit more fiddly, but it will give you an outside pickup of the tape. So much more support to the hips and the femur. So straight away, it's giving you a lot better pickup. It's going to show you hoisted on this hoist here. This is one of our Silvalea's hoists. If you are interested, there's a full section on the website, but it's got a very clever shore clip fixing, which means you've got to lift it physically to put the tape on. You go short shoulder, long leg, just to start with. So leaving in slings is another dilemma. You know, I know certainly you've got to ensure that it's suitable to be left in, but it's all about working out the most appropriate product. This fabric is a lightweight, four-way stretch breathable mesh, which has been successfully used for leaving in. So, you know, subject to risk assessment for suitability, but often people like to leave the product in to reduce handling. But it's got to be suitable. Are we all right?
Yep.
And again, before you go too far, just take up the slack. Double check we've got everything attached. And caught the chair. Okay. So this is the In-Situ Deluxe. Again, we'll let you have the link. Just show you. You can see these leg paddles here. They fully support Judith's femur there. And you can see how the fabric hugs the body. There are bones in the head support which you can take out if they're too rigid, because you've got a head support tape here that will support. We do a full session on leave-in products, so if you want more information, please look at that on the prospectus for the sessions, and we'll explain things in more detail. But just looking at the style, these individual paddles, then if Jude's a bit wriggly or a bit agitated, then we've got the individual support from those paddle legs. And because it's picking up from the outside, it's not going to cause the rotation of the first style. It's giving more stability. Particularly if we add a tape, this is a hip tape here, which will help to lift the hips. They're a great addition if you've got someone with significant pain. On this style, it helps to lift the hip, distribute the weight, and take pressure from behind the knee. So a great addition. They're on a slider buckle here, so it just needs to the tension needs to be the same as the leg. So lifting simultaneously with the leg. It's a bit loose at the moment, so it's not doing anything. But if I just explain, it will just take up that slack there. But a great addition also for anyone that's asymmetrical, so that then you can just position the tapes asymmetrically to give that support where needed. There's a little bit of an aperture here, so often hygiene transfers are needed. So then you can have, or you can allow for that with this style. So particularly if you've got no lower clothing on, then access can be done, or a transfer can be done quite quickly. It's made in the superfine fabric. There are other leave-in products. This one's the lightweight one. But all of the fabrics for leave-in are made of a mesh, so they can be used for bathing. If you are then transferring to a chair and you're worried about the legs, then it's advisable then to just take that down. Just take the legs to the side, undo them, and then just ease them. They've got both sides are slip fit fabric, so they can be eased out and positioned to the sides. So that's reducing what's left underneath. If you're worried about, there's binding, but it's all down to the individual requirements. And often leaving in slings it's just a sensible, balanced decision. If you've got someone that needs the support from those legs because they're quite active, then it's a really good shape. We've made this for 30 years without any issues, so we know historically that it's a very good decision or good choice. Have you got any questions on that? We have another style which I'll show you that doesn't have the aperture, so there is another option, but before we show you that, I will show you a toileting sling. The toileting slings we know carers love because they are easy to fit and quick to put on when a toileting scenario arises. This is the traditional one, and you can see there's not much to it. Certainly, you know, you've got to have reasonable to good upper body strength to cope with it. And it needs to fit firmly, which in many scenarios, people don't like that fitting because it's too tight, but it's got to fit firm to give support. But the alternative to that one is the low convenience. The low convenience is a little bit different. It's got a structured panel in the back and the legs, so it's firmer. It's got a deeper back, so it gives more support. But the inside has this elasticated waistband. Don't turn that one round. That one's just a solid one on the Velcro, which can loosen off. We know, you know, it doesn't stay firm unless you keep tightening and tightening. So it can slacken off, whereas this elasticated one will keep its shape. So we'll just put this on Jude, just to show you. Thank you. This elasticated panel waist support is detachable, so you can interchange sizes, which is quite good. But because it's very firm, you can get it into tighter situations, more structured seats. Fit the waist support at the waist. Always on toilet things, it's a waist support, not a chest support. So fix it low and firmly. But this one's got lots of give, so it will hug, you know, very well. And you can tighten it with the elasticated bits there. So really good. The leg paddles have the foam in as well. So getting it into tighter chairs makes it easier. And then the fabric's got a natural sheen, so it slides really well. Just cross the legs through. Okay, we'll just hook it up. Go on, thanks, Jude. Arms are always on the outside, go on the yellow there. And it's really important when applying a toilet sling, just to check. So if you've got the standard waist support, as the body naturally thins out when the hoist takes up the slack, that waistband will loosen off. So double check and tighten it if required. This version, of course, isn't going to loosen off. But always keep it low. Don't have it on the chest. It needs to be under the chest at waist level. And then it'll keep the whole thing down. Because often toilet slings, they just ride up and then cause problems under the arm. And that's because it's too big or it's fitted too high. So this is the low convenience. Again, we'll let you have the link, and you can see the back section there, much deeper than a standard access hygiene sling, but really good access to the belt line. It's a great alternative, and often it will be more popular because of the extra support, the benefit of the waistband, and the support it gives. How are we doing? Any questions? I think what we'll do now is we've got some accessories to quickly show you. Rhiannon's just going to, on the website, just bring some of the accessories that are available. They're all clearly detailed on the website under transfer accessories, I think. But just to give you an idea, there are many slide sheets, turning discs, handing belts, repositioning sheets, many options. And if you have a specific need to see one, trial one, always get in touch. You know, we can make sure we've got a selection that we can see that would be useful, because we know it's always difficult to measure the success without trying. But there are, you know, there's a big selection of products there. Just out of interest, though, if we can just click on the Bradbury Turner, which is a turning device, it will just give you an idea of what you can, further information you can see. So all the products are very clearly photographed, explaining their uses. There's sizing guides to help. So this is a data sheet with everything on there to help you determine sizing, if there's options, and the USPs for the product, safe working load, the washing. There's instructions of use, and in many scenarios there's a video. So we do have lots of help for you. There's lots of downloadable fact sheets as well. So it's a very informative website, sort of developed from listening to you guys and trying to then come up with answers and solutions for you. So every product will have a full page of information. Thank you. Thanks, Ray. So how are we doing? Any questions? So what I want to do now is just to show you the other sling that we know is very successful or very popular in nursing home environments. And it's one that often is left in place because once you get this on, it's hard to get it out. So it's very good for all situations, particularly amputees. So amputees can be a bit of a worry, but if you've got long amputations, then standard slings will work. But if the residual limb is very short, high, through hip, then this is a really good option. It's the In-Situ recline. This one's made in a spacer fabric, which is a three-dimensional mesh that will compress, but we can do it in other fabrics, but this is the preferred one. It has got a little pommel here in the middle. So this needs to be fitted on a bed. I mean, Judith's obviously cheated, but it's easier or needs to be applied on a bed. We just hook it up just to explain. Okay to go on yellow? Yeah. Again, it's always just take up the slack and just check. Okay. I've got a hip tape 1 minute. Yeah. So it picks up like a seat. But what's quite nice on this one is it's this pommel helps to lift that centre. So by lifting that centre, it just balances the legs. They don't roll in. So if you have got amputees or an amputation, then it will slightly lift to help with comfort. But nicely positioned towards the back of the knee. The fabric, it naturally will hug the contours. It's got that give around. No access for hygiene though. So you need to be mindful that this one, you don't have access for hygiene. It doesn't have a head support, but we can provide one, or a little neck cushion that can go in. And it will come with the option of this hip tape. So this hip tape loop there means that you can then get an additional hip tape separately to help with just lifting that area, as we've talked about the benefit of that. So a really good, one of our most popular styles. But what I'm going to do now is just introduce our chair, because this is a new chair to Silvalea. It's a tilt-in space chair daybed. I'll show you how beautifully we can get Judith into this. But whilst I'll just position it. I've opened up the sides. These sides come out so that we can get Jude right to the back of the chair and lower her down. And then we can leave this product in. And then we can smooth it out and close the sides up so that it's really smooth. But I have got a little presentation on this, which we'll just talk about in a moment. It's very lightweight though, it's fully adjustable. I just take Jude to the side and then lower her down It's important to get her positioned right to the back. We do. Right to the back of the chair. And then I'll take off the tapes. I can just show you then how neatly it taps away. Yeah. Undo that. Down there. And then I can just close up the sides. See that the sling is smooth. The sides there and here. But whilst I just want to give you some more details on this. So Alice, my colleague, is just going to show you and talk through some of the other features of the chair.
Morning, everybody. Hopefully you can see my screen. It should say Silvalea on it right now. So I'm just going to talk to you a little bit today about our chair and just kind of like its features and benefits. So this is our Air Comfort Deluxe V2 chair. It's got, like Amanda said, fully adjustable recline, seat tilt and leg rest. Fully adjustable wings, drop-down arm sections for easy side transfers, adjustable and removable headrest. It has on its, which I'll go into more detail in a second, but there is some features with its casters as well. The great thing about this chair as well is that it's replaceable covers and parts. So if anything gets ripped or damaged or worn, you can simply buy a replacement cover for it. And those are all wipeable and able to be used with mild disinfectant wipes. So there's just some more information on our chair. So the features and kind of like how it's created is it's an air system. It's not alternating air, so there's no pumps or electricity required. It's basically 5 bags of air or pillows almost of air overlocking one another so that when pressure is applied, like in the image, it gently transfers over to the next airbag so it evenly displaces the air to give the feeling of floating on air. So on top of those the air cushions, there are 2 inches of memory foam on top of that. So really durable, prime comfort. It's so comfortable to sit in. So again, as I said, they're all removable and it works really well for contracts because or care homes, if you need to recycle this chair, you can wipe it down, you can replace any covers you need to, and because of the sides being able to be pulled down, you can get really in there and clean those properly. So great for infection control. This is a medium to high pressure care product, so really good if you've got people that suffer with pressure sores or pressure injuries. So here's just a quick slide on our pressure mapping for this chair. So as you can see, we've got competitor 1 and competitor 2, and then ours features on the left. So great pressure mapping information we have, and we can share this, it's not a problem. But as you can see, peak pressure is 60.8, and it's worked really, really well. So this is just sizing, and like I said, all of this is available on our website. So we do have this in 3 options. We've got small, standard and maxi. The small is the yellow one on the left-hand side, and the right one is the standard, but we also do maxi, which looks like the one on the right-hand side. But you can measure. Safe working load is 28 stone for the small and the standard. The maxi is 47. Here's just some images of our chair in use. So just quickly, just because it's very brief, but if you do want information, we can share this. Just some features of our chair, sorry. So the tilt-in space, you can see there, and as Amanda demonstrates as well now, it does lie really flat, so brilliant for side transfers. It's got the tilt-in space feature, so you've got full control and adjustability there. It's not in like locking sections, it can lock wherever you want. So you can achieve the best position as Amanda's doing now. Judith is lying flat with her legs raised and she is in a very comfortable position. Just to add, we do know that people really comfortably sleep in these as well. So as I mentioned, the casters, there are some features and benefits of these. So we have 3 red ones because that's just a locking system. The green one is for basically inline caster, so brilliant for hospitals or going down a corridor. These go really nicely on carpet as well. So in our training studio, we do have some carpet and we can easily maneuver one another around when we do exhibitions and demonstrating in people's houses and they've got quite thick carpet. It works really well because of the 5-inch twin lock wheels. So chair width, we've already covered this, but just to show you another image of the chair laying flat. So some accessories that work really well with our chair and that we've kind of created as well. We have a footrest. This is a fully adjustable footrest, so it slots into place, so you don't have to have it, but a lot of people benefit and get that feeling of being grounded. The footrest is not adjustable when in position, however, it can flip up and if standing is required, as you can see in the images on the left. But you can, it's really easy to slot in and out. It doesn't come as standard, but it's just an additional extra. We've got a meal tray. This can be attached in the two holes at the front. Amanda, if you could just point to those, that'd be brilliant. So you can see those there. That's where it just slots in. So again, this doesn't come as standard, but it's a plastic tray that has anti-slip rim and molded drink areas. So it can be used for meals, games, activities, reading, anything really. But it's fully wipeable, so great for infection control as well. We've created some bolsters to come with the chairs as well. So we have a 2-meter and a 1-meter. As you can see, they're demonstrated in the pictures here. But basically, we did these instead of having like thoracic sections on the chair because we know that can kind of impact the sling and application of the sling. So when you saw Judith be transferred into the chair, there was no interference from any trying to think what they're called now. There was no interference from any position aids, basically. Yes, yeah. So you can put, if Judith had like a left-sided weakness, we can adjust the bolster to give her a support for her midline section. So as I said, they're available in 2 sizes. They're easy to be wiped down as well. And a lot of people have actually bought these not just in line with the chair, but for in the bed because they are so comfortable. So they're really, really great bits of accessories. We also have a lap belt if you need these to help your client feel more secure. They're fully adjustable. It's secured from the back. So this is, again, additional extra, but it provides the users and caregivers a bit of peace of mind and ensuring a safe, comfortable seating experience. So it's attached around the back, but then you've got a clunk clip at the front, and there's also a little cover sleeve that goes over the buckle, so for client comfort. So this is just some more features on our chair. And this is our pediatric chair. Although we've called it small, not pediatric, because small adults can fit in it as well. So it depends on your client's height and width as to which chair you would go for. So that's it from the chair. I'll hand over back to Amanda. Thank you.
Great, thanks very much, Alice. Thank you for doing that. Let's just check. Does anyone have any questions on the chair, or they want to see some of the features in more detail? We do have really good coverage throughout the country of this, with our agents being able to bring them out, because as we all know, it's good to see them, try them. So please, if you feel that it's of interest, then let us know and we can get a trial organised. We'd be very happy to sort that. Again, with the slings as well as that, but the chair, it's very lightweight and very manoeuvrable. Certainly we presented it at the National Back Exchange last week and people were very impressed. Very, very lovely, and it feels like you're floating. As Alice said, it's got these airbags which distributes the weight without the need for pumps. And just naturally finds where the support's needed. So for vulnerable people with, potential pressure sores, then it is a very good alternative sort of chair to consider. It's also a very good width that will go through doorways that then there's no need for adaptations, so standard doorways. And it's also got very good height for the legs to get hoists in. So hoists will slide in very easily underneath because of the height of those of the frame. So lots of pluses. So please, you know, if you do need to see one, we would certainly arrange that for you. So finally, there are just a few other products that we'll just share with you, and they are Standaids and things like that. So I think, Ree, if you wouldn't mind just bringing up the options. There's many different Standaids. We know Standaid machines have clips, loops, mixture. So there are a variety that we can offer. Again, the website will give you very clear images. So if we can just show the, yeah, that's fine. That's a transporter one. So the transporter one is a Standaid, but it'll give you a bit of support in the event that somebody will then maybe lose their standing tolerance. But it's not to replace a sling that when somebody needs total support, because they're non-weight bearing. So it's still to go on a Standaid machine, and the Standaid machine is for standing. But there's that option. If you can go back to one of the Standaids, get that, yeah. And this one is just a very standard one. They vary in as much as some will have deeper backs, higher backs, but they'll all do the same principle. And again, the key thing is to position it in the right place so it doesn't ride up and bite under the arms. Get the question there, do we, Ree? Just checking we may have a question.
Can you recommend anything which will protect a hernia or stomach bag when using a powered Standaid?
Right, okay, so that would mean a hernia. The thing is, you need to probably add something extra. So it's whether you can fix that to the Standaid. We do have like supports. It may be that we need to know a bit more information and see what's going on in order to advise. But we do have lots of historic knowledge on complex things and unusual things. So if you would like us to discuss that in more detail, then just let us email the customer services email, and then we can set something up. We do lots of link up like this to see what's going on. So the e-assessments, basically virtual, with Alice or myself, and they're very popular. It means we can get to you quicker. We can demonstrate a solution or an idea so that you can see what's available. So we're very happy to do that. We do that most days all over the world, basically, just to quickly advise. So, you know, please, any queries like that, we've got a very good team. Customer services will, email address will then be distributed to the relevant advisor. So please use that. Is there anything else? Let's think about it. I'm mindful of the time. Do you think there's anything we should share? I mean, you deal with nursing homes.
Yes, I think
any most common issues that we've missed?
No, I think we've
covered it. Has anybody got anything that they would like to share, or something that they constantly have a struggle with? So actually, was fine before we go. Sorry, Ree, you haven't got the sling selector anywhere, Andy. We do have, as I said earlier, lots of really useful information, and we do lots of these sessions. But what is quite helpful is for if you have a team or you think they would benefit from a session like this, then we've got this wonderful poster where you can select some products and we'll set up a session for you. So these are all the products on the website, but they're in families of shapes. So like, for example, number one are all the general purpose shape slings, which we slightly talked about, and then the deluxe legs, hammocking ones, toileting, etc. But there's also harnesses, the Standaid options, and all the accessories. So it's a great picking list if you feel actually I need to look at a few more things. So use that to select half a dozen products, and we can then go into more detail for you. But we'll let you have this. We'll send out a little bit of feedback, a feedback form after. If you'd kindly fill that in, then we'll make sure you've got the information required. But if that's all, thank you very much, Ray. Thank you. Thank you very much for your time. We want to help you. We're very happy to help you. So please ask. And I very much look forward to seeing you in future sessions if you've got chance. We've got a prospectus on the website. We're just developing a new one for the next 6 months, so that'll be out shortly. But thank you. Thank you very much. Thank you to Ray, Judith, and Alice, and hopefully see you soon.